Now, as way of background, when thinking about the circulatory system, of course, everybody would think of the heart as the main pump for normal cardiovascular physiology. But it's important to note that indeed there's a second pump in the circulatory system, which we would call the calf pump. And the calf pump, as you would anticipate, exists in the lower extremity. And with contraction of the calf musculature, the calf pump enhances right atrial preload and cardiac output through augmented venous return to the right atrium and the right heart. My name is Rob McBain. I'm one of the members of the vascular division, the Department of Cardiovascular Medicine. And I'm delighted now today to tell you about a manuscript that we've recently had accepted to the Mayo Clinic Proceedings entitled Calf rEF, the impact of calf muscle dysfunction with reduced ejection fraction on all-cause mortality. It's going to be published in the June Mayo Clinic Proceedings edition. Now, there are several important components of a normally functioning calf pump. You have to have a patent venous outflow, of course. You have to have patent channels for blood to flow through. You have to have competent venous valves, and you have to have an intact neuromuscular function of the calf musculature such that the calf pump functions well. As a way of background, we know that chronic venous disease is common in our country. It impacts approximately 25 million Americans, and this can lead to leg swelling or edema, ulceration, or for some patients, impaired ambulation because of venous claudication. Now, in the vascular laboratory, we can measure venous physiology using a device called air plethysmography. And air plethysmography it's a tool that we use every day in the vascular lab. And this tool provides real-time assessment of venous obstruction, venous filling and emptying rates, and chronic valvular dysfunction or incompetence. It's also important to note that the air plethysmography can give us a measure of calf muscle pump function, which can be expressed as a percentile of ejection fraction, much like we would get an ejection fraction of the left ventricle. We have previously shown that abnormal calf muscle pump function is an independent predictor of all-cause mortality among patients with and without heart failure. And we've also shown that abnormal calf muscle pump function is an independent predictor of venous thrombosis. The current study aimed to determine whether adverse outcomes of calf muscle pump function provide a graduated response with respect to the ejection fraction and all-cause mortality. In order to accomplish this, we assessed consecutive adult patients who underwent air plethysmography in the vascular laboratory between January of 2012 and December of 2022. These individuals were then divided based on their calf ejection fraction for assessment of all-cause mortality, and we divided patients by 10% deciles. So, for example, less than 10%, 10 to 20%, and so on. Over the study timeframe, nearly 6,000 patients met our inclusion criteria. And during the nearly 3-year median follow-up of these 6,000 patients, there were over 400 deaths. And it turns out that all-cause mortality rates increased with each 10% decrement in the calf muscle ejection fraction. Now, this mortality was not accounted for by venous valvular incompetence or other measures of venous insufficiency, but there seemed to be predictive based on the venous disease severity score, or the SEEP score, which we use every day in the vascular laboratory and vascular consulting clinic. After adjusting for a number of clinical covariates, both the calf ejection fraction and the clinical venous severity score remained independent predictors of all-cause mortality. Now, the mechanism for these findings is unclear. We had postulated that perhaps this is a surrogate for other diseases, including frailty, which may be responsible for the finding. We have not been able to substantiate that. However, in recent studies of frailty, there was no relationship. It is important to note, as I previously mentioned, that abnormal calf function in patients can be a predictor or independent predictor of venous thromboembolism, and it is possible that pulmonary embolism may be a contributing factor for all-cause mortality. Lastly, it's possible that abnormal calf muscle pump function alters cardiac preload and output, and therefore may be a surrogate for heart failure as part of the mortality signal. In summary, patients with reduced calf pump ejection fraction have an increased rate of all-cause mortality, and this mortality rate appears to be increased with each 10% decrement in calf pump ejection fraction. Now, the mortality mechanism does not appear to be impacted by venous valvular incompetence and is likely due to other mechanisms which require further investigation. With this new manuscript now, we would coin the term calf rEF, which signifies patients with calf muscle pump dysfunction with reduced ejection fraction. Thank you for spending some time with me.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.